Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office. We've got a lot of information today. We've got a special guest that's going to be joining us in just a few moments. But before we do that, we want to get into the numbers of the day. And we're joined today by our director of the St. Clair County Health Department, Barb Holt. Barb, it's always a pleasure, and I'm glad you've been able to find some time 24/7, I know, but to join us today.
Absolutely. I'm very glad to be here, and again, staff have been working very hard to get information out to the public and educate the public, do our contact tracing and try to help battle and help control this COVID virus that's in our community. So with that, today our report, we have an increase of 628 folks that we have tested. So for a total of 28,020 folks tested that have been done so in St. Clair County. Of that, we have 43 new cases that were positive for COVID, and a total of 24,861 that are negative. Unfortunately, sadly, we report one death of a female in her 70s with unknown underlying health conditions, but again, we extend our sympathy to the family as well as the other 148 that have passed away in St. Clair County. We're sad to report associated with COVID. And also, those folks that have completed the 14-day quarantine, we're up to 2,182. So we're so very glad those folks have recovered. Statewide, the state has tested 2,308,854 folks, with an increase of 955 positive cases today, for a total of 167,703 cases. Unfortunately, we have an increase of 23 deaths in the state of Illinois today, for a total of 7,324 deaths. Our hospitalization numbers in St. Clair County, we're glad to report we don't have any patients that are on a ventilator, and we have 37 COVID-19 related patients that are hospitalized as of today in St. Clair County. We're also very glad to report that we have no changes to any of the congregate settings or long-term care facilities. No new cases in either clients or staff, and no deaths in any of those congregate settings or long-term care facilities. So that's very good news. Very good. Today we had our testing team out in Dupo that finished this afternoon at 3 o'clock, and latest report, we tested over 200 folks today, and test results take about 5 to 7 days. Hopefully as soon as we get them, we'll call folks and let them know their results, but the labs are very, very busy, but as soon as we can get them, staff are calling to let you know what your results are. Tomorrow, we will be at Fairview Heights with the testing clinic from 10 to 12 and from 1 to 3. This will be at Moody Park, which is at the corner of Longacre and Ruby Lane. So tomorrow, 10 to 12 and 1 to 3 at Fairview Heights. And then next week, we're very glad to announce Illinois Department of Public Health, in cooperation with St. Clair County and many of our municipal leaders, will be here for 7 days. On Monday, July 27th, we'll be in Millstadt at Lennenkratz Park. On Tuesday in Caseyville at Caseyville Village Park. On Wednesday in Muscuda at Chevy Park. On Thursday, July 30th, we'll be in New Athens at their Oak Valley Park along the Kaskaskia River. Nice breeze there. And Friday, July 31st, we'll be in Lebanon at the Prescriptions Plus True Value Hardware parking lot. And then on Saturday and Sunday, August 1st and August 2nd, we'll be at the Belleville East High School at the lower parking lot. And every one of these will be from 8 to 4 each day. So we'll have more of this information on our website, and we'll be pushing this out through our communities as well. So if you have a chance, please get out, get tested. If you need any more information, please check our website at the Health Department or the EMA website. So with that, just another reminder, folks, we're in this together as a community. So to help control this virus, we need to, and I'm sure you all heard it, do the 3 W's of wear your mask, wash your hands, and watch how far away you are from folks. Stay that 6-foot social distancing, and those are the things we can do as a community so we all win out of this. Up until we get a vaccine, that's what we got to do. So again, take care, community, get yourself tested, and I'll turn it back to Mr. Chairman, Mark Kern.
So Barb, you've really been working. You're now at over 10% of the county that's been tested. You know, for a long time it was 1%, 2%. We've really upped the game in St. Clair County to where we're now doing thousands of tests a week. Last week, IDPH spent 5 days, I believe, in East St. Louis or around East St. Louis, maybe Washington Park one day. Next week, you're going to be everywhere from Chevy Park to Liederkranz Park in the outer county. So we're just trying to get these numbers. We need people to go out and get tested.
Absolutely, and that's what it takes for us to help control this virus. But I do want to mention one thing, sir, that again, even if you test negative, your test of being negative is just for that one day when you get tested. That doesn't mean that 2 or 3 days later you may become exposed at a different site. So it's not a get out of jail free card if you're isolated or quarantined just because you test negative. The virus takes 14 days to develop, so any time of day 1 to day 14 you may test positive. So please again know it's just a point in time of a test.
But today's test showed a 6.8% positivity rate. That's better than where we've been.
Yes.
It's well below the 8% that the state has been talking about to where they're going to clamp down and maybe close a few things. So let's keep that level there. And the way you do it, wear a mask, watch your distance, and wash your hands.
Absolutely. Absolutely. Thank you, sir.
Thank you, Barb. Thanks for being here. And so an old friend of our program, a COVID survivor, is joining us today. Kevin Anderson Sr. Has agreed to be here again on the program. And if everyone remembers, Kevin contracted COVID, and he was in dire straits. He spent 37 days in the ICU, and when he came out, he's got a mission. And he wants to tell people about COVID and tell them how to prevent it and make sure that other people don't walk in the same shoes that he has. Mr. Anderson, welcome. Thank you for coming back here.
How you doing today?
I'm doing well. How about, I can tell you're doing well.
I got my right-hand man with me again.
You do. Ramon is there with you, and you got a smile on your face. Last time we saw you, you had lost 70 pounds. From your visit in your 30, how many days were you in the hospital total?
Roughly 37.
37 days, you lost 70 pounds. You put back a few of those pounds.
Yes, sir.
Is that what pancakes and T-bone steaks will do?
Yes, sir. Now put it back on you fast.
Well, that's good. That must be my secret. But let's talk about so last time you heard, just give a briefing to people who may not have seen our last episode with you in it. Tell us about your days in the hospital and specifically when you found out you had COVID, what you felt like, and then where you ended up.
Well, I was at work, and in a couple of days I was feeling bad, so I decided to go to the urgent care in Collinsville and get tested. Soon they tested me. They told me to go right to the hospital because they thought I had contracted it, which they already knew, but they didn't want to say. So I went there, drove to the hospital. As soon as I got there, they got the clothes off of me, almost had to cut them off, and started getting that fever down. My fever was at 105.9 or something. It was crazy. And after that, they admitted me, and I was in ICU for 37 days. The first days I was in there, they sedated me. Then I went into a slight little coma. Then I went on a ventilator. Then I had blood clots in my left leg. They feed me through tubes, to try and keep my weight up. I didn't eat or drink anything for almost 4 weeks while I was in there. And it's a trying time when you go through that. Your family can't come see you. Then, it's hard for you to stay in contact with them because you're sedated, you're on a ventilator, and I caught all of it. I had some underlying issues, for as I had sugar diabetes, and I had bronchitis, high blood pressure. Not that bad, but people don't know it attacks all those extremities in your body. If you have asthma, bronchitis, sickle cell, cancer, these are things that COVID looks for. It look for things that it can latch onto and mess up your respiratory system and whatnot and everything. A lot of people don't know that you can help some of this by washing your hands and putting your mask on and staying social distance. But also, you have to be mindset. If you're not teaching yourself, how are you going to teach your kids for them to go to school? They have to take on your persona. They have to see you doing it, so they'll do it. And these are things that's going to hurt us come school time. If these kids don't see the parents doing this, then they can't do it. They follow by example. And the thing right now, we're crossing to a danger zone right now with school opening. So we still got a little time, but still we got to work on our kids and teach them the right way, because we don't want them to get sick. Ages 10 to 18 can pass this on faster too. You're 10 and under, it's still iffy. But the CDC always said, you got to follow these numbers.
These numbers are impacting younger people more. Today, our numbers, 50% or a little more than 50% of the people that caught COVID in our numbers today are below 40 years of age. That was different than when you had COVID and you went in the hospital. Everybody was thinking it was just applied to older people and those with immune compromised systems. Now we're finding this is much more broad-based than what happened to you. It certainly is happening to a lot more people. But you had a severe case, and you went in and you were on a vent for 15 days?
Yes, sir. 15 long days.
And you heard whispers in neighboring rooms. There were people who passed away of COVID in the hospital near you.
Right. And some of my coaches down in East St. Louis passed. One of my coaches passed from COVID. She had cancer. And wow, you just don't know how this attacks, it makes you feel and everything. And people don't know when you get out of that hospital, you start seeing the people that have passed. And like I'm telling a lot of people, I had it. So what they was doing, they was isolating my grandson because they thought he had it. You know what I'm saying? He's only 8 years old. There's some people didn't want him around. And people don't know how this can make you feel or how this can destroy your family. It's hard to tell your grandson that he can't play with other kids because his grandfather had.
Yeah.
And a lot of people, and this will harm you more than what people think it does. It hurt you mentally and physically.
But where a lot of people, that might be enough to pull their cork under, you came back strong, and while you were there in bed, you actually turned what happened to you into a much longer story. So now, because of what you were thinking about when you were there, you've created a nonprofit foundation that's going to help kids and help youth in the community by creating an awareness poster. Can you talk a little bit about this?
Yeah, my poster is focusing on the 3 W's. Wash your hands, watch your distance, wear your mask, and then too, it tells you the 7 symptoms to be looking for: coughing, harsh breathing, diarrhea, and so many other things. It's a lot of things that warning signs now that I didn't know before I went in. And the poster is going to help us raise money to buy books for kids that can't get computers, they can't get laptops, they can't get certain things. When this thing strikes, our education system is going to take a backlash right now because of the simple fact some kids are going to go to school and some kids are not. But what about the kids that can't go to school, that don't have a laptop, don't have a computer and whatnot and everything to work on it? So we're on a mission. We're on a mission to buy books for these kids so they can learn how to read. Because if they can't read, how can they do other things? And computers are fine, but at the same time, you got to have reading materials for these kids out here in these non-private areas. Some kids don't have internet. Some kids don't have computers. So what do? But books will never go out of existence. My mom was a school teacher 39 years, and she stressed that education on reading. And we got to go back to that, because if we go back in another phase and we have to shut down schools, we're going to have these kids some reading materials ready so they can start reading. At least they can keep up, with their education and whatnot. Computers are fine, but books will never go out of style.
And you've got experience because you do mentor and you teach youth on the weekends and in your spare time. You have always been part of a program like that.
Yeah, and I've been working with the Little Knights. I work with the YMCA. I coach basketball at the YMCA. I coach football. I work with the Jackie Joyner Center on baseball and trying to raise money to keep the fields up and whatnot. And then, too, we work on these kids on Saturday mornings at the East St. Louis Library. I'm trying to get that started back up, but we don't have any reading material. We got some, but we need some up-to-date reading material to educate these kids. And we're on a mission to try and raise some money to get these kids some books. So on Saturday morning, they can come in and read if they don't go to school or they can't get to a computer.
So we're going
to upgrade.
So we'll post about your foundation on our page here. And let's take the full circle and go back to COVID. So you're out, you're energized, and then you find out that you've got nerve damage in your hand, in both of your hands, because of the length of time that you were in the hospital. Can you talk a little bit about the long-term effects of COVID? You're out, and they said you don't have it anymore, but you're still dealing with the problems associated with it.
That's correct. I just had surgery on my hand last Thursday, and today I had 2 chromosome shots in my shoulders because laying in that hospital bed for that many days, you lose muscle mass, and it's still sore. My left leg had blood clots in it. I'm still taking blood thinner for that after that much time. My wrist still hurts. It's some things that still haunt you after you get out. People just think, well, some people don't have it that bad, but I had it bad. And what happens is that you got to prepare yourself. I had to latch on to something to say, hey, I got to find something that make me get myself well to keep going. And my grandson is one reason. I have to forge ahead because it leaves a lot of pain on you. People just think, well, I'm quarantined for 14 days. I'm gonna go back out. But if you have any underlying ailments, like the lady in Florida, she lost both her kids. She lost her son one day, and then 5 days later lost her daughter. And that's 2 kids in less than 6 days. See, it has to hit home for us to really realize what's happening. Sometimes it takes a tragedy. And we shouldn't want a tragedy to make us wake up and everything and see this. This is serious. By October, they saying we'll probably be at around almost 200,000 people. This is like a football field in Michigan, University of Michigan. Imagine that stadium empty, and it holds like 125,000 people, and the stadium just empty. That's what it looks like.
Well, we're proud that you're here and you're a survivor and you're a part of Team St. Clair, and we appreciate that. And Ramon, I can tell that you like your grandpa because you're hanging all over him and you're making sure that he's gonna have everything he needs to get back to 100%, right? There we go. That's all right. Mr. Anderson, I sure appreciate you being on here today. Herb, have you got anything?
Yeah, just one question, Mr. Anderson. As we talked last time, and I know it probably hasn't changed, but when you hear the people say that this COVID is the flu, it's no big thing, what do you say to that?
Wait till November or December. I hate to say this, but you wait till November and December when it's flu season in, and then this thing raises to another level and everything. This is something that we really got to take serious because it's summertime now. Imagine when it's getting cold and everybody's isolated inside, it's going to magnify even worse because this is a form of flu to a degree. This is not nothing to play with, especially with these young kids with these sniffles and coughs. When some of these kids are in school, they put their hands up underneath the water hydrant to get water. They can pass on this at the drop of a dime. Okay. And this is not nothing to play with. And we're going to see the harshness of this winter. I hate to say it,
Well, and that's what we've been trying to do, is to get the word out, and that's why we're so thankful that you were able to come back on. As the chairman said, you're definitely a success story for Team St. Clair, and I'm sure all of our viewers out there really appreciate that information.
And you've got the scars to prove just how serious this is.
These battle wounds, these are battle wounds. These scars are gone. It's the battle wounds that keep people don't know. You got to take this serious, because if you get what I got and you're not strong, things can happen. And you hurting your family by not doing what you're supposed to do. You're not hurting yourself, you're hurting your family and other people around you. So take this serious.
Great. Thank you for being here today. You're a real man. Thank you.
Thank you now.
Thank you, Mr. Anderson.
Okay, so at this time we'll move into the zip code reports, which is a regular part of our program. In 62059, we remain at 8 today. 62201, we went up by 3 today to 155. 62203, we remain at 117. 62204, we went up by 1 to 94. 62205, we stay the same at 122. 62206, we remain the same at 281. 62207 went up by 6 today to 165. 62208 went up by 1 to 173. 62220 went up by 3 today to 254. 62221 went up by 4, and they're now up to 274. 62223 stays the same at 125. 62225 remains the same at 12. 62226 goes up by 2 to 318. 62232 stays the same at 66. 62239 stays the same at 25. 62240 stays the same at 6. 62243 remains the same at 17. 62254 stays the same at 106. 62255 stays the same at 8. In 62257 we go up by 1 to 18. 62258 goes up by 1 to 38. 62260 goes down by 1 today to 29. And as we've said in the past, that zip code can go down because a person may have given the wrong zip code when entering a facility, or they may have moved into a different area. So we keep our numbers accurate. So our zip codes are a day-to-day, the most accurate figure we can give you. So it goes down by 1 to 29. 62260 goes down by 1 to 29. 62264 remains the same at 63. 62269 goes up by 5 to 183, and 62285 remains the same at 27. Herb, last night, waiting for dinner, and the phone rang, and Governor Pritzker called and wanted to talk about our numbers in St. Clair County and why they were up, and what exactly was going on. I know Barb Holt has been in touch. Dr. Ezike has been called Barb on Saturday, and Barb and I talked on Saturday. The state's paying special attention to us, and they really have throughout this whole time. They made sure we had the PPE that we need, the testing that we need. All these things came to St. Clair County. The dollars that it takes to make this work, to do the tracing, and Barb is working on even expanding into more people doing that, helping out with the tracing as we raise our testing now above 3,000. We're going to get to 5,000 before we're through. Tell me, Herb, the governor came today then to Madison County. He was right on the border, and we were in Collinsville talking about COVID. What do you make of the fact that there are some new standards, and we're in a new district, and we are getting close to that 8% level now with the rises we're seeing in Randolph County, Monroe County Sheriff Clinton is seeing a rise. What do we make of this, Herb? How do we make sure that we stay out of that 8% number?
Well, I think with all the long night conversations that we have, and of course with the work that Barb and her team are doing, that's why we went back to the daily briefings. We were hoping doing the weekly briefings was going to be enough, that our residents was going to take heed of our warning that we were doing. So that was the first step, but we've been concerned. Today, the numbers, 43 over the last 24 hours of the testing, is a lot better than what we did on Saturday when we were in triple digits. Of course, you and I have said all along, we were basing a spike on the 4th of July weekend. So hopefully we're going to see that continue to go down. But it's concerning. The state runs behind on their region, and that's what I want everybody to remember. We had a lot of messages on the page last night. Our percentage, our positivity rate was up for over 3-4 days. It's got to be looked at for the region. Right now, 7.1, I think, is the report we had today. So we're close to the 8, but we're still below it, and that's where we want to be.
And I think we were 6.8 today.
6.8 today, so we're going in the right direction.
And we looked at those rates yesterday. So we compared, we looked at July 4th to July 18th, the 2 weeks past July 4th. And then we went back and said, well, let's look at June 4th to the 18th. Let's look at May 4th to May 18th. Let's look at April 4th to April 18th. And our numbers are, if you look at the positivity rate, are improving. The positivity rate in April, I believe, was about 16%.
Yeah.
And now we found that the average rate from July 4th to July 18th was in the 10s. It was 10.3. So we're seeing a positivity rate that is moving in the right direction. The hospitalizations are moving in that same right direction. Today, once again, we don't have anyone on a ventilator. Unfortunately, we added a death today, which is what we absolutely do not want and hate. But we seem to be seeing numbers moving in the right direction because the health department's out there. They're tracing, and that just involves a phone call that says, "Hey, you've got COVID. You're tested positive. You need to stay home. And by the way, where do you think you contracted this? Were you within 6 feet of anyone when in the past few days when you were contagious?" It's simple questions. It's not invasive. There's no names associated. The confidentiality is there, the HIPAA laws. This is only designed, just like wearing a mask and washing hands and watching your distance, it's solely designed to slow the spread of this virus so people don't get it, people don't die from it, people don't have long-term issues like Mr. Anderson talked about, where now he's got to go back in for carpal tunnel and he's got nerve damage and yet he's got such a positive attitude because he beat this. He beat COVID, and that's why we want St. Clair County to beat COVID. That's why we're here. That's why we're saying, wash your hands, wear your mask, and watch your distance.
Well, and I think it's important, and that's why I want all of our followers, because we've got such a great team of Team St. Clair, and we have a few of the people that are still naysayers, as I call them, but I don't want our team to get sidetracked, because we are watching these numbers, and when I say we're doing it 24/7, we are doing that. So just take a breath and let us continue to crunch those numbers. And your part of being part of that solution is, as the chairman and Barb has said, wear the mask, wash the hands, and watch the social distancing. If you do that, we've got this thing pretty well under control. The testing sites is only going to, I think, get better. I want to give a shout out to the mayor of Dupo for his help today. State Representative Nathan Wrights was there because those are the people we rely on for the PPEs when we need them. And I want to give a shout out to the mayor of Lebanon. He put out a nice PSA for his constituents, and all the mayors and all the chiefs, the police and fire chiefs, they're all in this together with us.
And all the reps and senators. I saw Senator Belt today, and Latoya Greenwood, and Rachel Crow, and Katie Stewart. They all asked. They all came around. Jay Hoffman, I had a phone call with him early this morning, all asking, what's going on with the numbers? How can we help? We have, and from the governor down, everyone is interested and wants to try to figure out how to get these numbers to where they're zero.
Well, and I think the proof of that in the pudding, as my grandmother used to say, the governor calling you at supper time last night saying, what can we do? What can we do to stabilize St. Clair County and the Metro East area? And then to come today and bring that message. Now, yeah, it was kind of a warm, stern message that, look, we got metrics we got to go by. And so we need all of our county residents to look at that. And I think it's working because if you've noticed the last 48 to 72 hours, some of our corporations are saying, you're not coming in if you don't have a mask on. You know, some of the events now, nobody wants to cancel events, but people are stepping up to the plate saying, we're going to do this. There'll be next year. Some of the ones that's been sent to us, the Shiloh Homecoming is canceled for this year, Fallon City Fest, the Belleville Chili Cook-Off, Oktoberfest, and then the Collinsville Italian Fest. That tells me that those community leaders and those Chamber of Commerce people are taking this real serious. And so they're planning ahead. We want to thank Mr. Anderson for his part today, the rest of the week, because what's one of the big topics other than COVID-19, along with that, is back to school. So the rest of this week, Wednesday, we're going to have Belleville 201 superintendent on. Thursday, Mr. Culliver from the St. Louis School District 189 will be with us. And then Friday from the Wolf Branch, Dr. Nicole Sanderson, I think is, if I'm reading that correctly, will be here to fill out the week. And they'll be answering questions on how those districts are preparing for the schools. They'll be able to tell you, hopefully, of what type of program that we're going to be looking at throughout the districts in the county. We did take 30 pallets of PPEs today. I want to thank, I'll tell you, the Highway Department, Mike Suarez's people came in, and then, of course, the men from the courthouse, from Jim Brady's office, the 30 pallets on a semi that blocked the road out here.
And your crew here too, who gets
we won't
everything
talk about
organized.
them.
How do you get 30 pallets in the basement of this little
It's there.
building?
It's there, believe me. And part of that load came in today is some of the school supplies, the mask and the hand sanitizer that each of our school districts throughout St. Clair County are going to benefit from. So Team St. Clair, have faith. We're in this together. We're not going anywhere. We're going to be here, and we're going to fight this invisible enemy, as you hear us say all the time. And for those of you who haven't been convinced yet, if listening to Mr. Anderson didn't convince you, then I have to say I lost the battle with trying to convince some of you, because he really is a story there. And as far as I'm concerned, he's on that top of the list of Team St. Clair. We're going to be back momentarily with the ladies to translate this into our Spanish communities, and then we'll be back here tomorrow afternoon at 3:30 for the next briefing. Have a good evening.